Discover the potential harm of 10 medications to your liver. Learn about drug-induced hepatitis, where liver damage can occur immediately or within 90 days after ingestion. The liver, responsible for eliminating toxins, plays a vital role in our body's detoxification process. Unlike kidneys, the liver lacks a replacement machine if it fails. In the US, over 2,000 cases of acute liver failure occur annually, half of which are attributed to medications. Identifying the 10 medications causing liver harm is crucial to avoid excessive use. In this video, explore these harmful medications and understand the early signs of liver damage due to medication. Let's delve in. The liver acts as a crucial filter, processing alcohol, medications, drugs, and toxins and eliminating waste through bile and urine. Due to this detox function, certain substances can be extremely harmful to the liver. Recognize early signs of liver damage caused by medications or supplements: stomach pain, fever, diarrhea, nausea, vomiting, dark urine, white-colored stool, yellow skin, jaundice, severe fatigue, itching, and skin irritation. The time for medication to damage the liver varies based on individual sensitivity, dosage, age, existing liver problems, or substance use. Symptoms typically appear 5 days to 3 months after treatment initiation. While focusing on medications, alcohol causes severe liver damage, 10% of transplants, and illegal drugs like cocaine also harm the liver. If a doctor prescribes the discussed medications, continue using them under their guidance. Explore the top 10 medications damaging the liver. 10. Diclofenac, a potent anti-inflammatory, stands out for its elevated risk of causing liver injuries. While all anti-inflammatory medications pose some risk, diclofenac carries the highest potential for liver damage, with manifestations appearing weeks or months after usage initiation. Awareness is crucial to mitigating this risk. 9. Amoxicillin plus clavulanate, a widely prescribed antibiotic, demonstrates effectiveness against various infections but raises concerns due to its association with acute liver injury. Monitoring and prompt medical attention are essential when using this medication. 8. Amiodarone, a cardiologist-recommended medication for treating cardiac arrhythmias, proves highly effective but comes with a notable side effect profile. Its use has become more restricted due to potential liver damage and other side effects affecting the thyroid, lungs, and skin. Caution is advised, and regular monitoring is essential to identify harmful effects on the liver, which may take weeks to manifest. Understanding the benefits versus risks is crucial when considering this medication. 7. Allopurinol, commonly prescribed for individuals with elevated uric acid levels or suffering from gout, offers relief but carries the risk of liver injuries. Swift action is necessary, as liver injuries associated with allopurinol can occur rapidly, often within days or weeks of initiating treatment. Regular medical follow-up is paramount, ensuring prompt detection and necessary adjustments to treatment to prevent severe complications. 6. Anticonvulsants like phenytoin and valproic acid, used to manage seizures and other neurological disorders, can cause liver damage. Phenytoin may initiate liver injury shortly after usage begins, while valproic acid's effects may manifest between 1 and 6 weeks. Regular monitoring of liver enzymes is crucial to detecting signs of damage early, allowing for appropriate adjustments in treatment, and minimizing the risk of hepatic complications. 5. Methotrexate, a medication widely employed to treat conditions such as rheumatoid arthritis and psoriatic arthritis, demands continuous monitoring of liver enzymes. Regular tests help identify early signs of liver damage, ranging from mild to severe. Proper adherence to medical guidelines regarding dosage and frequency is imperative to minimize the risks of side effects, including potential liver injury. Adjustments in treatment may be considered based on patient response and health status. 4. Antifungals, particularly fluconazole and itraconazole, are potent medications effective against candidiasis and nail fungus but are associated with hepatotoxicity in susceptible individuals. Users should be aware of signs of hepatic toxicity, and caution is advised when using these medications. Regular monitoring and immediate medical attention in case of any unusual symptoms are crucial to ensuring timely intervention and minimizing potential liver damage. 3. Methyldopa, commonly used to control high blood pressure, is generally considered safe but has been associated with potential liver damage. Patients with existing liver diseases should avoid its use, and regular monitoring is recommended. Adverse effects on the liver may manifest up to 12 weeks after initiating treatment, underscoring the importance of vigilant supervision to detect and manage any signs of liver impairment. 2. Antipsychotics like risperidone and quetiapine, used in the treatment of psychoses and refractory depression, carry the potential to cause liver damage through drug-induced cholestasis. This interruption in bile flow from the liver can lead to hepatic damage. Close monitoring for signs of liver problems is essential for individuals undergoing treatment with these antipsychotic medications, balancing the benefits with the potential risks. 1. Paracetamol, a widely used medication for pain relief and fever, is associated with drug-induced liver failure, particularly with excessive doses. Overdose, often due to misuse, can lead to acute liver failure with a high mortality rate. It is crucial to adhere to recommended doses and seek immediate medical attention in the event of an overdose. The antidote acetylcysteine can be effective, but swift action is necessary to prevent the need for a liver transplant. It's crucial to note that the absence of a medication on this list doesn't guarantee liver safety. Many medications, including antiretrovirals, vitamins, antibiotics, supplements, and teas, have hepatic potential. The liver's vital role makes cautious medication use essential to prevent drug-induced hepatitis. Severe cases may lead to fulminant hepatitis, impacting overall health. Share this knowledge and subscribe for more insights. Until the next video, thank you. Remember that even though medication isn't mentioned, it doesn't mean it's entirely safe for the liver. The list of medications with hepatic potential is extensive, including antiretrovirals, vitamins like niacin, other antibiotics, supplements, and even teas, as discussed in another video. The liver is a vital organ, and any malfunction can have a significant impact on the entire body. To prevent drug-induced hepatitis and, in severe cases, fulminant hepatitis, it's crucial to approach all medications with extreme caution. Fulminant hepatitis affects a significant number of people with acute drug-induced hepatitis, leading to jaundice, yellow skin. Among these cases, only 20% survive without a liver transplant. This emphasizes the importance of using medications responsibly and being aware of potential liver risks. For those using medications like methyldopa, which is often prescribed for high blood pressure, regular monitoring is essential to detect any signs of liver impairment promptly. Patients with a history of liver diseases should discuss safer alternatives with their doctors to prevent further damage. Antipsychotic medications, such as risperidone and quetiapine, Seroquel, used in the treatment of psychoses and refractory depression, have the potential to cause liver damage. Careful monitoring for signs of liver problems is necessary for individuals undergoing treatment with these medications. Paracetamol, commonly used for pain relief and fever, is associated with drug-induced liver failure, particularly with excessive doses. An overdose can lead to acute liver failure, emphasizing the importance of adhering to recommended doses and seeking immediate medical attention if an overdose occurs. While an antidote for paracetamol overdose exists, acetylcysteine or fluimucil, it's crucial to seek emergency medical attention instead of risking the need for a liver transplant if an overdose occurs. The video concludes with a reminder that responsible medication use is essential. The liver's crucial role in detoxification underscores the need for caution with all medications, whether they are on the list or not. The video encourages viewers to share this knowledge and subscribe to the channel for more insights. The importance of understanding medications that can harm the liver is emphasized to empower individuals to make informed choices about their health. The liver, being a vital organ, requires careful consideration when using medications to avoid potential harm. The video concludes with a call to action, urging viewers to share the information and subscribe for more educational content. Until the next video, thank you for watching.